everyone, welcome to the Physio Department's Mums and Bubs postnatal class. I'm Megan and I'm here with Eddie. We're the Women's Health and Paediatric Physiotherapists here. Normally you would have been invited to our Mums and Bubs postnatal class about 2 months after you delivered. We would have run it over 2 sessions, the first all about information relating to the mum and the second all about information relating to the bub. But unfortunately, due to COVID-19, we can't have big groups in the same place at the same time. So we're going to record ourselves and send it to you. So today I'm going to be recording the mum section. You'll also be sent the bub section. So let's get on with it. So the first thing we're going to talk about today is the pelvic floor. So what is the pelvic floor? It's a big sling of muscles that attaches at the front of your pelvis at that pubic bone right at the front and slings through to attach at your tailbone or your coccyx. And what it does is when it's nice and strong, it helps to close off all your openings to help maintain your continence, so stop urine leaking out of you when you don't want it to. But it also helps to keep your pelvic organs up inside you. So that's your bladder, your uterus and your bowel. It helps them to stop them from dropping down. So it has a very important role. So there's lots of different things that can impact on your pelvic floor. And one of those biggest things is pregnancy and your delivery. So if we were to compare vaginal delivery to cesarean delivery, during a vaginal delivery, those muscles, those pelvic floor muscles actually stretch so much to allow the baby to go through them. During a vaginal delivery, you may also have an episiotomy, which is where they sort of cut the skin to allow it to expand for the baby to come through. You may have a tear as the baby comes through, and we'll talk a bit more about them in a minute. If you have forceps, that can actually cause some damage to those pelvic floor muscles. Same with a vacuum delivery. And if you had an extended second stage labour or an extended pushing phase, then that can cause some issues to your pelvic floor as well. With a Caesar, you have delayed healing of the core muscles because they've been cut. So it takes a long time for those muscles to start firing again, and they actually work very closely with your pelvic floor as well. And both of those have lots of impacts on your pelvic floor. So simply being pregnant actually puts lots of pressure down on your pelvic floor. So the weight of the baby makes the pelvic floor muscles stretch themselves. Some people find that they get constipated or they have to strain to empty their bowels or bladder while they're pregnant, and that's constant straining puts lots of pressure on your pelvic floor. Simply being pregnant means you're carrying a bit of extra weight, which is more pressure going down on your pelvic floor. And lack of use. So if you're not completing your pelvic floor exercises like you should be, then they might get weaker as well. So we're going to start off by talking about recovery post C-section first. So it can be quite a long physical recovery. If you think about it, your abdominal muscles have actually been cut and sewn back together. So it is going to take a little bit of time for that to heal. So it may take 6 to 12 weeks for your body to heal. And in this time, it's highly recommended that you avoid any heavy lifting or strenuous activity, and then you slowly build up. So what's suggested that you avoid is lifting any heavy load. So that might include baskets of wet washing. Older children, if you've got toddlers at home that still like to be lifted and carried, we suggest that you don't do that. Shopping bags, like grocery bags, a baby bath, if you move that to a higher surface, maybe get someone else that's at home to do that for you. Even lifting a capsule in and out of a car, and heavy housework like vacuuming and sweeping. So we definitely would recommend that you don't do those for at least the first 6 weeks, and then between the 6 and 12 weeks, you slowly start to reintroduce those things. And it's definitely recommended not to do any vigorous exercise until about 12 weeks postpartum after a C-section. From about 6 weeks postpartum, once your C-section scar has completely healed up, you can do some scar line management or scar line massage. And that helps to sort of reduce the visual appearance of your scar, and if you're one to heal with thick scar tissue, so if it's raised or tight, it really helps to prevent those. It helps to reduce the potential of sharp or catching pains when you walk or stretch through your abdomen as well. So we recommend that you wait until all your stitches are resolved, the wound is completely healed over, so there's no open bits. And if you just spend about 5 minutes each day, maybe with Sorboline or a gentle moisturizer, if you just run your fingers sort of perpendicular to the line, so over the top of the line, up and down, just as deep as is comfortable, it helps to kind of break up the scar tissue and stop that from becoming really thick, and stop it from causing what's called adhesions, which is where it sort of grips on and starts to heal to the underlying surfaces. So we want all the layers inside you to be gliding on one another, not sticking together. So now we might talk a little bit more about vaginal deliveries, and specifically some tears that can happen during labour. So you might have all heard that people can have a tear during their delivery, and they're very common. So a first degree tear is usually what we consider quite mild, so it's actually just a little bit of the skin on the outside has torn, and it hasn't actually gone very far inside you and hasn't actually torn the muscles, it's just a bit of the skin. A second degree tear is when the muscles start to be impacted a little bit, so those pelvic floor muscles have actually torn a little bit. Third degree tear is when the tear actually extends from the vagina back towards the anus, and a little bit of what's called your external anal sphincter, so the muscles around the anus, have torn a little bit. And a fourth degree tear is when that external anal sphincter and the internal anal sphincter, so the one that sits up inside you, have both been torn a little bit. So if people sort of have third or fourth degree tears, then you will be referred to the Royal Women's Hospital in Melbourne just for some follow-up, just to make sure that there's no ongoing continence issues down the track. But the best thing you can do to manage your tears after your delivery is to have good bowel habits. So avoiding constipation as much as you can. So some things that you can do for that are drinking plenty of water, especially if you're breastfeeding, because you can get a bit dehydrated, and we want your stools to be really soft. So drinking lots of water can help keep your stools really soft and prevent you from straining. Having a really good diet, so eating lots of fruit and vegetables that are rich in fibre can help to keep those stools soft and keep the stool moving through the bowel to avoid straining as well. And some natural laxatives, if you are having a bit of trouble, are kiwi fruit and pear juice. So they're some natural foods that actually work to soften the stool. Now, if you're having more and more trouble with this, there's obviously lots of laxatives and medications out there that you can get to assist this. And usually if you've had a tear or a severe tear, once you leave hospital, the doctors might give you a script for some laxatives because we really want to avoid constipation. So next we're just going to talk about some really common pelvic floor problems that we see in postnatal women. So there's actually quite a few different things that can occur from pelvic floor issues. So we're going to be going through a couple of these in a bit more detail, but these are just an idea of some of the things that can be impacted by your pelvic floor. So stress urinary incontinence, we're going to be going through in a bit more detail. Fecal incontinence, pelvic organ prolapse we'll talk a bit more about. The pelvic floor plays a big role in your sexual health and sexual function. So some people with some pelvic floor issues might report reduced sexual function, so pain with intercourse or other issues with intercourse. They might have reduced back support if the pelvic floor muscles are weaker, and then that might lead to some back pain. Reduced core muscle function, so your pelvic floor is considered part of your core, which all act to protect your lower back. So again, it might mean that your abdominal muscles aren't firing as well. Another thing that can happen is some people actually have an overactive pelvic floor, or pelvic floor muscles that grip on really, really tightly and don't ever actually relax, and that can cause lots of pelvic pain. It can cause constipation, painful intercourse, and could be really annoying for some people as well. So next we're going to talk about a thing called stress urinary incontinence, which is very common in the postnatal population, but just because it's common doesn't mean it can't be fixed. So what it is when you leak a little bit of urine when you cough or sneeze or jump or run, and it occurs because of a pressure issue. So what do we mean by a pressure issue? So what happens is when you cough, sneeze or jump, there's a buildup of abdominal pressure. Now normally when your pelvic floor is nice and strong and hasn't been stretched, your pelvic floor can withstand the pressure pushing down on it from your abdomen by squeezing really tight and closing off all the tubes that exit your body. So it closes off the urethra, which the urine travels through, and it closes off your rectum, where your stools travel through. So it can close them off so nothing can leak out. But after you've had a baby and those muscles have been stretched and weakened, when you cough or sneeze or jump, in some cases, the pelvic floor just isn't quite strong enough to actually close off your tubes and withstand the pressure pushing down, in which case a little bit of urine, and in some people's case a little bit of stool, might actually leak out. So it's actually quite not easily fixed, but it can be definitely fixed by strengthening your pelvic floor so that your pelvic floor can close off these tubes and help to keep you continent. So for all you mums out there who are busting to get back into some high level exercise, so that might be running, netball, tennis, heavy weights at the gym, or like those HIIT classes, what you can do is this pelvic floor stress test just to see if your pelvic floor is strong enough to withstand the pressures that you'll be putting on it when you do vigorous exercise. So we definitely recommend wait until 3 months after your delivery to try this. If you get to the 3-month mark and you've had no issues so far, you're not leaking any urine when you cough or sneeze or anything like that, you've got no pelvic pain, then have a go at this. So what you do is you drink about 600 mils of water and then you wait about 30 minutes. So that ideally your bladder is getting towards the full side. After the 30-minute mark, you jump on the spot for 1 minute. So pretend you're skipping maybe, then do 5 star jumps, do a big double barrel cough, and then have a look in your undies and see if you've leaked any urine. If you have leaked any urine, that might mean that your pelvic floor is not yet strong enough to withstand the pressures that would be put upon it if you were to go back to exercise. So you can just give yourself a bit longer, do a few more pelvic floor exercises. Or if you feel like you've been doing heaps of pelvic floor exercises since your delivery and no matter what you do, you're still leaking, give us a call here and we'll book an appointment with a pelvic floor physiotherapist who can assess your pelvic floor and see if there's something else going on. If you get to that 3-month mark and you're already having some issues, then maybe don't try this because that's already a sign that your pelvic floor is not going to be strong enough. So again, give us a call and come and get your pelvic floor checked. The other main type of urinary incontinence is called urge incontinence. And what that is when you get a sudden, strong urge to urinate. So it's not that gradual build-up. It's just bang, I've got to get to the toilet right now. And often you might leak on the way to the toilet. This is very common postnatally as well, and it can also be improved by strengthening the pelvic floor muscles. So again, if you're experiencing a bit of this, go back to your pelvic floor exercises, keep doing your pelvic floor exercises. But if you get to that 3-month mark and you think this isn't improving at all, give us a call again at the physiotherapy department here at the Horsham Hospital and book an appointment with the pelvic floor physio just to get checked as well, because there's a few different things that can cause this as well. So another common thing that can happen to women, especially after they have a baby, is what's called a pelvic organ prolapse. So what that is where one of the 3 pelvic organs, so your bladder, your uterus, or your bowel, kind of herniates into the vagina or sort of drops down into the vagina. Now, I guess the risk factors for a prolapse might be things like a long pushing phase or lots of downward pressure, so straining, being constipated a lot, lifting really, really heavy weights or returning to exercise too soon after having a baby, or constant coughing. Some people that have chronic lung conditions actually give themselves a bit of a prolapse from coughing all the time and having lots of downward pressure. So I guess the first symptoms people usually report is sort of like a throbbing ache in their vagina or a feeling of fullness or like a full tampon's falling out. It can also cause a little bit of lower back pain. It might cause a bit of urinary leakage. Lots of people also report actually feeling, if they did a little internal exam of themselves, they might feel a lump or a bulge in their vagina. Depending on whereabouts it is, if it's quite low, they might even see it at the opening of the vagina. Or they might find that intercourse is a little bit more comfortable, a little bit more uncomfortable than usual as well. So they're relatively common. Lots of people actually have a prolapse that's quite mild, sitting up quite high, and they don't actually get any symptoms. So it might just be later on in life they go for a pap smear and the doctor notices a little lump or a bulge, but they actually would be unaware of it otherwise. So everyone that does have a prolapse has different degrees of symptoms. So someone might have a very, very mild prolapse that's sitting up very high, and anatomically the doctor might say, oh, that's a tiny prolapse, you don't need to do anything about it, but they might actually have a lot of symptoms. They might be leaking urine, have a lot of pain and discomfort, whereas someone might have quite a severe prolapse anatomically, so it might actually be kind of sitting right at the vaginal opening or even extending down, but they actually don't get any symptoms from it. They don't feel it at all, and they don't get any pain, or they're not leaking. So the symptoms don't really correlate with anatomically what's going on. But if you have been feeling any of those symptoms at all, again, you can give us a call here at the physio department at the Horsham Hospital, and we can check and give you a bit of rehab to do to help improve your prolapse. Otherwise, your GP can refer you to a gynecologist, which is, I guess, a profession that specialises with conditions such as this that relate to the vagina as well. Usually they'll refer you to physio anyway for some rehab to help improve it. So I guess the moral of the story is that all of these conditions can actually or generally be improved with pelvic floor exercises. So I guess how do you do a pelvic floor exercise is the main question. Hopefully a few of you have been doing them since you gave birth, but if you haven't, now's a good time to start. And what it is, it's squeezing the muscles as if you're busting to do a wee, and you've got to squeeze everything down there to hold it in. So what it feels like is it feels like a squeezing around your vagina or even around your anus, and a lift upwards through the vagina. So some people use, I guess, urinating as a guide. So if you went to the toilet and you urinated and you tried to cut off your flow midstream, the muscles you use to do that are your pelvic floor muscles. So when you're doing that, you're doing a pelvic floor exercise. Now, we don't encourage you to do that every time you urinate, but that can just be a good test on if you're getting the right muscles contracting or not. So what we generally encourage is for new mums to do about 10 squeezes every time you feed your baby. And that way you're doing lots and lots throughout the course of your day, because I'm sure a lot of you are feeding every 3 hours or so. And if you did 10 squeezes every time you did a feed, by the time you got to 3 months postnatal, your pelvic floor should be nice and strong to withstand some pressures and hopefully mean that you're not leaking any urine. So lots of people ask how long do they do the pelvic floor exercises for, or when can they stop? So generally we say if you're breastfeeding, you should continue doing them the whole duration of your breastfeeding, just because when you're breastfeeding there's lots of hormonal changes, so you have lower estrogen, and estrogen is one of the hormones that helps to thicken up all the linings in your vagina. So while you're breastfeeding, you have thinner linings, and you are more likely to prolapse and have issues. And that's not a bad thing. It's definitely worth breastfeeding. It just means that you should probably do a few more pelvic floor exercises than those who aren't breastfeeding. And after that, we would suggest that you do them 2 to 3 times a week, just like any other strength exercise. So the Australian guidelines on physical activity recommend that you do strength training, so that's like body weight exercises or lifting weights, that you do that 2 to 3 days a week and use that in conjunction with your cardiovascular exercises. So the pelvic floor is just like any other muscle in the body. It needs to be used regularly. So yeah, if you haven't been doing them, I suggest that you start doing your pelvic floor exercises now. Another type of pelvic floor exercise that you can start to do now is called the knack. And all it is when you squeeze and lift your pelvic floor muscles before you cough or you sneeze or you laugh or you lifting heavy objects or even lifting your baby. And what this does, when you start to do this early postnatal, like you guys are, it helps to get your pelvic floor coordinating nice and quickly when you do these sorts of activities anyway. So before you had a baby, your pelvic floor naturally would have squeezed and lifted when you coughed or sneezed or laughed without you even thinking about it. Now that your pelvic floor is a little bit stretched and weak, it needs a little bit of help. It needs you to consciously contract it when you do these things. But if you start to sort of do them every time you cough or sneeze or lift, then eventually it will become second nature for your pelvic floor just to automatically contract again when you're doing these things. So maybe think about that next time you feel a cough coming on. Try and squeeze your pelvic floor right before you cough, and then relax it after you finish coughing. Same with if you're picking up a heavy load of washing or even picking up your baby. Give it a go. So I've talked a lot about what can happen when your pelvic floor muscles are weak, but there is a lot of women out there who actually have overactive pelvic floors. And this can happen postnatally as well. So the women who think they're doing the right thing and do heaps and heaps and heaps and heaps of pelvic floor exercises, if they actually weren't that weak to begin with, they might mean that it's overactive. And you think, oh, that would be all right, because it would just mean that your openings are always closed off. But for a healthy muscle to be strong, it needs to be able to relax and contract. So I guess if you think about your trapezius muscles, or the muscles up around your neck, if they are constantly contracted and just get higher and higher and higher and tighter and tighter and tighter, you're going to get really, really sore neck, and your shoulder is not going to be able to move as well. So it does actually cause lots of dysfunction. So it's the same with your pelvic floor. So if there's increased tension there and they're always tight and can't fully relax, it can lead to lots of other issues. So it can actually lead to leaking, because the muscle needs to be able to relax to then contract again to close off your urethra and stop urine dribbling out. It can also lead to pain with intercourse, just because those muscles don't relax enough to allow for comfortable penetration, and those women can find that it's really uncomfortable to have intercourse. It can also just cause general pain. So you can just have general pelvic pain or back pain just day to day doing everyday things. So it is important, I guess, if you are experiencing any of those things, come and see one of the pelvic floor physios here at the Horsham Hospital, because there's lots of different things we can do. So we can do internal releases. So just like any other muscle, we can do a trigger point release on the pelvic floor muscles to help them relax. And we can teach you some exercises that help to actually down train or relax your pelvic floor, or stretch it. Just like you would if you had tight neck muscles, you would stretch them out and help them to relax. So give us a call if you think that you're experiencing anything like that. Now, a lot of you would know by now that after being pregnant and delivering your baby, your abdominal muscles or your six-pack muscles might actually separate, and you get a little bit of a gap between down the middle line of your six-pack muscles. And that's very, very common. You all probably would have had your tummy assessed by a physio when you delivered your baby in hospital. And we generally say that about 2 centimeters wide is normal, so you're pretty lucky if you had it under 2 centimeters. And generally under 2 centimeters, it comes back together, no worries. If it's a little bit higher than 2 centimeters, it might take a little bit longer to get back. You might have been given a bit of tubey grip or been told to wear some compression around your tummy to help get those fibers back together. So there are some exercises that you can start to do once you're about 6 weeks postnatal if you're feeling up to it. And we've got them coming up on the next slide. So one of the muscles that's important in healing your, it's called a diastasis, or your abdominal muscle separation, is a muscle called your transversus abdominis. So that's an abdominal muscle that sits, it's very low on your abdomen, and it attaches at your spine and wraps around, kind of like a belt, where a belt would sit. And if that's nice and strong and firm, it helps to support your spine and prevent back pain. So one of the rehab protocols, I guess, of healing your diastasis is getting this muscle nice and strong again. And in the upcoming slides, we've got some progressive exercises that you can try. So before we get stuck into the exercises, I'll just talk about some recovery shorts or recovery garments. So as I said, once you leave hospital, if you've got a larger separation that's more than 2 centimeters, you would have been given a bit of tubey grip or compression to wear around your abdomen to help bring those muscle fibers back together. And that bit of tubey grip is free and would work fine, but some people find the tubey grips a little bit uncomfortable and would prefer to wear some recovery shorts or recovery leggings, which are high-waisted shorts and leggings that are specifically designed for people with vaginal tears or abdominal muscle separations, and it's got compression built into it to help those fibers come back together. So I guess the garments are ideal for abdominal muscle separation, even cesarean or vaginal wound support, helps to support the pelvic floor, but it's not going to do the job that pelvic floor exercises would, but it does just help to provide a little bit more support. They have been advertised to help with urinary incontinence, mobility and stability. They do kind of help to suck everything in and make you feel a little bit more firm. I know after you first have your baby, you feel a bit jiggly and you feel like you can't hold yourself as strong. And that's probably because your abdominal muscles are a bit weaker. So it does just help to support them in your lower back for a little bit longer. So you can wear the recovery shorts up to about 3 months, or as long as you like, really. Ideally, you get the most recovery in the first 6 to 8 weeks. So as I mentioned before, your transversus abdominis muscle, that low-lying abdominal muscle, is really important in recovery of your diastases, or even if you have some pelvic floor dysfunction like a prolapse or stress incontinence. This muscle plays a big role in that. So I guess if you've ever heard of Pilates exercises, they're exercises that are designed to sort of strengthen this muscle. So what we generally encourage is for people, once they get to sort of 6 to 8 weeks postnatal, and if they're feeling okay and wanting to do a little bit more than just static pelvic floor exercises, they might like to get into some gentle transversus abdominis exercises. So this picture here that you're seeing in front of you, what she's doing there is she's got a towel wrapped around her waist with the two ends of the towel sort of crossed over. She's just doing like a little baby crunch, I guess you'd call it. And at the top of the crunch, you pull the two ends of the towel across your tummy. And what that does is it helps to just sort of pull your separation closed with the towel, pull those fibers back together while you're contracting your abdominal muscles to do the crunch. So that's one that you could try at home. I guess a safe prescription of exercise would just be to do 10 at a time and just 3 times a day. But definitely waiting until you're at least 6 to 8 weeks postnatal. If you've had a Caesar or your wound is completely healed, if you've had a tear, your wound's completely healed and your stitches are dissolved, and only try this if you're really feeling up to it. We've got some more Pilates exercises on the next page as well. So on this slide, there's a couple of just gentle Pilates type exercises that are generally safe for women that are in that postnatal phase. So if you're feeling like, if you're 6 to 8 weeks postnatal, you're feeling pretty good, any wounds and stitches have completely resolved, and you're feeling like you want to do a little bit more, have a go at some of these Pilates exercises. There are also some local mums and bubs Pilates classes. I know that one of the private practices of physiotherapy in town run mums and bubs Pilates that are specifically designed for people postnatal that have had complications with their deliveries, had cesareans, and they're very safe to do. So if you wanted to have a look into that, you could. I'm not sure if they're running right now with the COVID-19, but hopefully they'll be up and running soon. So lots of women have questions about how to lose weight safely after pregnancy. And while this isn't necessarily something that physio is an expert in, there are some little tips that we can give you. So I guess the first bit of advice would be not to stress about it immediately postnatal. So give yourself at least 6 weeks to recover before you even start thinking about it. Some safe guidelines from the Physio Association of Australia say making time for breastfeeding in the morning, eating 2 fruits and 5 vegetables a day, including plenty of fibre-rich food such as oats, beans, lentils, grains and seeds in your diet, and going easy on the fried foods and lollies, and just watching your portions and the number and types of snacks. So just your general weight loss principles. If you're breastfeeding, it does take a lot of energy to produce the milk for your baby. So you do actually need some extra calories or kilojoules in your day. So the guideline is around 2,000 to 2,100 kilojoules extra a day. Some of you might be meeting this from your body's existing fat stores, and that means that the breastfeeding can help you to lose weight if you just kept at your current kilojoules per day. And it is safe to lose weight in that way. So the next couple of slides are just on mastitis. So mastitis is an inflammation of a blocked duct in your breast, which can lead to infection. So a blocked duct itself is where a milk duct a bit of milk sort of gets stuck in your milk ducts, and usually you can feel a bit of a blocked duct by doing a self-assessment of your breast, and you might feel a little lump. Generally, if you get it nice and early and you're feeding from that side and you're using some heat and some massage, you can move it on before it gets infected. But every now and then it might be really difficult to move, or you might not pick it up early enough and it might become infected. So, and that's when it becomes mastitis. So the signs and symptoms of mastitis are a red sore area on the breast. It might feel firm throughout the breast tissue, it might feel sort of warm, and you can even get sort of like flu-like symptoms. So feeling hot and cold, sweats, aching joints. So they're sort of the signs of mastitis. So the reason we've got these slides on mastitis in the physio talk today is because physio can actually help if you've got some blocked ducts. So if you've got mastitis and you do have those flu-like symptoms, the first line of treatment is to go to your GP because you may need antibiotics. But your GP may refer you to a physio, especially if you've got recurring mastitis, because we can use an ultrasound machine, which is pictured here. An ultrasound has actually been effective in helping to break up the area of blocked milk, break it all up so that it can be passed through the nipple when you're feeding. So we've had quite a few women come through physio here where they've had to have a few treatments of ultrasound, but it helps to sort of prevent recurring mastitis. But important to note, if you do think you have mastitis or you're getting blocked ducts, definitely GP first, and then if they think it's appropriate, they'll refer you to physio. So they're sort of the main things we wanted to go through today at your postnatal class on women's health. But there's lots of reasons that you might need to see a women's health physio. So if you're sitting there and you've listened to any of this and you think, oh, that's me, give us a call here and we can book you an appointment. So some of the reasons that you might want to see a women's health physio are so back, neck, tailbone or wrist pain are all very common in the postnatal population, and we can help with that. If you've got some painful scar tissue from your Caesar, episiotomy or tear, we can help with that. If you've got pain during intercourse, weak or separated stomach muscles, blocked milk ducts or mastitis, any bladder or bowel issues or leaking, if you've got urgency to pass urine or to use your bowels, or if you feel like you're passing urine much more frequently than usual, any sort of pelvic pain or pelvic floor weakness or that vaginal heaviness sort of feeling, anything like that, it's worth booking in to see a pelvic floor physio. And also, we don't have it on there, but if you're looking at returning to high level sport or exercise and you just really want to get your pelvic floor assessed to see if you're at high risk of anything happening, then again, give us a call. Now, if you have any questions about any of this, just give us a call as well. So we're happy to have a bit of a chat over the phone. We know that it's not quite as good as doing it face to face, but we're hoping that you get the same information. So thanks for listening, and we'll see you soon.